Armstrong Medical's range of 7 sizes of laryngeal airways are indicated for use during inhalation anaesthesia and resuscitation to secure a patent airway for the delivery and exchange of anaesthetic gases. Each airway comes individually packaged. The size of the airway is clearly visible on the packaging. Reusable laryngeal airways should be autoclaved before use. Open the packaging and remove the laryngeal airway and the logbook. You will require a sterile, water-based lubricant and a Lure slip inflation syringe of the required calibrated volume. Fully deflate the cuff using a syringe, with the bowl of the mask pressed down onto a flat surface. Apply pressure to the back of the cuff using your index and middle fingers. The deflated cuff should be smooth and boat-shaped. Apply lubricant to the rear of the cuff only. Spread the lubricant evenly over the rear of the cuff. Do not apply lubricant as to have excess material run off the cuff. Each laryngeal airway is packaged with a stylet to aid insertion. The tube lumen can be formed into the desired curvature by manipulating the tube lumen with the stylet in situ. Place the patient in the supine position with the neck hyperextended, unless there is any suspicion of spinal injury or resistance to positioning the patient. To insert the laryngeal airway, use the dominant hand to hold it like a pen, with the index finger placed behind the flange at the junction of the cuff and tube, with the black tram line facing the patient's nose. Introduce the mask into the mouth with the aperture of the cuff pointing towards the patient's feet. Press the tip of the laryngeal airway against the hard palate of the mouth cavity and push the mask backwards and downwards in one smooth movement until resistance is felt. The tip of the cuff should become located in the hypopharynx. Remove the stylet. Attach an appropriately sized syringe and inflate the cuff with the appropriate volume of air to effect a gas seal. Note that overinflation of the cuff is associated with herniation of the pilot balloon. When in situ, the flexible lumen can be adjusted to best serve the position of the anaesthetic circuit, or to accommodate the surgical field without disturbing the cuff position and seal. To use the autopilot auto-inflation technique, engage the pinch clamp before insertion to allow the pilot balloon to fill with the recommended fill volume. The pinch clamp should only be disengaged when the mask cuff is appropriately seated. Additional inflation volume may be required to effect an adequate gas seal. Successful insertion of the laryngeal airway should take no longer than 30 seconds. To use the Secura bite guard and secure the laryngeal airway in place, open the bite guard and push the airway into the centre of the bite guard. Open the patient's mouth and push the bite guard along the airway until the patient's lips and teeth are positioned over the protective shroud. To secure the bite guard, attach one end of the strap at hole 6, 7, 8 or 9 as appropriate to the anchor point bite guard. Pass the other end of the strap behind the patient's head and attach to the opposite anchor point on the bite guard at hole 6, 7, 8 or 9 as appropriate. To use the bite guard as an airway fixation aid, wrap the free ends of the strap around the airway and back to the same anchor point on the bite guard and secure using holes 1, 2 or 3 as appropriate. The strap ends should be pulled taut to grip the airway to prevent movement.